That doesn't surprise me.
$1 trillion.
That doesn't surprise me.
You voted for that, right?
I did.
Why didn't you care about deficits?
That's a good question. So when you get to vote, you don't always get to choose the right. When you're in Congress, sometimes you have to take votes that are not ideal. Sometimes you have to choose between choices that you don't necessarily like. What I liked about that bill versus the alternative, which would have made it to law, the alternative was a government monopoly drug program, which cost then $1 trillion, not $400 billion, and it would have basically not gotten the kind of savings we got. We got health savings accounts, which is an amendment I co-authored into the law, which has done a lot to help bring health insurance within the affordable range of people who didn't have it. It gave us new ideas on about how to break up the Medicare monopoly so we can get choice and competition in the program. And that, to me, was a far better path than the Senate prescription drug law bill, which was going to go to law if ours didn't. I spoke with, it was very clear to me from the president at the time, Bush, that either the Senate bill was going to become law or the House bill was going to become law. The House bill, and now evidence has proven this correct, is far better for the taxpayer, for the unfunded liabilities, and for the future of Medicare than this. Now, I would also say if Medicare is to be modernized, which that was called the Medicare Modernization Act, what health insurance program would not cover prescription drugs for a senior population? So, the problem we've got is Medicare now there's different measurements of this. Let's just say it's $31 trillion in unfunded liabilities. It's the biggest future deficit problem we have. So I think that law in 2003 has given us some really solid evidence about how best to reform Medicare in the future to meet its mission, to have it be comprehensive health care, and to make it cost less money.
May I please follow up?